I wanted to thank all of you for taking the time today to attend this webinar and discussion. We really appreciate it. We're really excited to be joined on this call by many staff from community-based organizations around the city, staff from New York City Council and other elected offices, and city agencies, including the New York City Department of Health and Mental Hygiene. And we also wanted to recognize all of the partners who are co-hosting this call. So as mentioned, we have the New York City Department of Health and Mental Hygiene. We have 3 partners as well, CBOs, who we connected to through the Protecting Immigrant Families campaign that we've been a part of for over 2 years now. That's the South Asian Council for Social Services, Make the Road New York, and the Arab American Family Support Center, who we have panelists from these 3 organizations who will be speaking on the challenges their communities are facing with public charge and potential solutions around it. So to introduce who CACF is, we are the Coalition for Asian American Children and Families. We are the nation's only Pan-Asian children's and families advocacy organization. We advocate for equity and opportunity for marginalized Asian American and Pacific Islanders, or AAPI, children and families. So we are trying our best to build an AAPI community too powerful to ignore. We do this through a couple of different ways. We are listening to identify our community's needs. We are training the next generation of leaders for our community. So that works through training and activating our AAPI youth, community organizations, and community members as social justice leaders. We are uniting our diverse community and our allies. We are building a strong and sustainable coalition of over 70 members and partners across all 5 boroughs of New York City. And we are fighting for equitable access to quality education, services, and funding for our community. We are mobilizing our coalition of partners and allies to fight for systems and policy change toward equity. So hopefully folks have had time to introduce themselves in the chat, but feel free if you've just joined to introduce yourself if you feel like doing so. And we just wanted to give sort of a brief agenda for today's hour-long meeting. So first, DOHMH will be giving a policy background on public charge and the history of public charge. Then CACF will go through findings from community research that we had done funded by the Protecting Immigrant Families campaign. And then our community speakers from the Arab American Family Support Center, the South Asian Council for Social Services, and Make the Road New York will be discussing the impacts of public charge and the community work that they are doing. And then we also have time at the end for a more open audience discussion and question time for anything you may want to ask or share with this group. So I will now pass it over to Rachel Schwartz, who will introduce herself and review the public charge background.
Thank you, Amy, and thank you, CACF, and the rest of the folks on the call today for being here. Very excited to share with you all. My name is Rachel Schwartz. I'm a senior policy analyst, as Amy mentioned, at the New York City Department of Health and Mental Hygiene in the Bureau of Equitable Health Systems. Can I get the next slide, please? All right, so before I get into public charge itself, I just wanted to give a little bit of background and context. So you'll hear me refer today to DHS, or the Department of Homeland Security, which is the agency, the federal agency that governs decisions on green card and other change of status applications that happen inside the US. DHS and USCIS, or the US Citizenship and Immigration Services, which is housed within DHS, are the main agencies that issue rules and regulations related to public charge. Next slide, please. So public charge itself is a term that's existed in immigration law and immigration policy for many, many years. It's not anything new. It's just changed a little bit. So public charge refers to somebody who is primarily dependent or likely to depend on the government for support. Since around 1999, the guidelines for public charge determinations have been based on guidance from USCIS, which you'll often hear referred to as the 1999 field guidance. And what that field guidance said was that only 2 very specific benefits would be included in determinations of whether somebody would be considered a public charge. And those 2 benefits would be direct cash assistance, something like TANF, or institutionalization for long-term care at the government's expense, which largely refers to Medicaid coverage for long-term care. Thank you. So the public charge test applies to a specific subset of individuals applying to enter the country or change their status. This includes some individuals seeking to legally enter the US, as well as some who are seeking to adjust their status or to receive a green card, and certain others who are seeking to either extend a current visa or change their visa type. Next slide, please. So this slide is a much longer list of who public charge actually does not apply to. I'm not going to review it all just for the sake of everybody's time today, but I just wanted to highlight a few groups to whom the public charge test explicitly does not apply. So public charge does not apply to US citizens. It does not apply to green card holders or those seeking to renew their green card status. It also does not apply to DACA renewal applications. And finally, it doesn't apply to refugee status or asylum or refugees and asylees who are seeking to apply for a green card. Next slide, please. And as I'm sure that everybody on this call is aware, in 2019, DHS under the Trump administration finalized a rule that expanded the definition of public charge and the list of benefits that USCIS would use to consider when determining whether someone was considered a public charge. So the rule added benefits including Medicaid, SNAP, which is food assistance, housing assistance, among others, to the list of benefits that could lead to a public charge determination. And the rule also redefined the term public charge and identified characteristics that would be considered negative factors that would increase the likelihood of someone being deemed a public charge. That includes things like prior receipt of public benefits or having a low income. It also included positive factors that would decrease someone's likelihood of being considered a public charge, but I'm not going to review those today. And as I'm sure you all also know, the rule caused a lot of confusion and a chilling effect among immigrant communities, including individuals and families that would not specifically be targeted by the rule itself. And the rule prompted, just a little more there. The rule prompted a number of legal challenges, including one that was filed by New York City, New York State, and a number of advocacy groups, including some that are on this call today. And following these legal challenges and the election of President Biden, the 2019 rule is no longer in effect. Next slide, please. So now I'm going to talk a little bit about where we are now and the status of public charge. So as I mentioned, the 2019 rule is not in effect. And so in 2021, the Biden administration announced that DHS would no longer defend the Trump administration's 2019 public charge rule in court or enforce it moving forward. Instead, the Biden administration opted to revert back to that 1999 field guidance that I previously mentioned when making public charge determinations. And what that means is they reverted back to only considering the limited benefits that I mentioned earlier, cash assistance, long-term care paid for by the government, in consideration of those public charge decisions. There was no more list of positive and negative factors, no more so-called wealth tests related to public charge. It reverted again back to prior to 2019. And in February of this year, DHS issued a proposed rule codifying the use of the 1999 field guidance moving forward. DHS also solicited feedback from stakeholders, including local government entities like DOHMH, on how to administer the rule in a way that would be more clear and cause less confusion or chilling effects on services. DOHMH, among many others, submitted comments, and we're awaiting the final rule, which we're hoping will be published in the next couple of months. And we expect that the final rule will look much like the proposed rule. We're just waiting to see if there are any sort of changes that'll be in that final rule based on the public feedback that DHS received. Next slide, please. So before I turn it over, I just wanted to share a couple of resources for New Yorkers with questions about immigration legal help or who are seeking healthcare services. So Action NYC is a program offering free, safe immigration legal help from a network of trusted community organizations and schools. It's accessible Monday through Friday, 9 a.m. to 6 p.m. at the number that's on the screen. And NYC Care is a healthcare access program that guarantees low cost or no cost services to New Yorkers who do not qualify or cannot afford health insurance. And again, there's more info on the screen. Last slide, please. And finally, if you have questions about insurance eligibility or need help enrolling, you can always visit our website and get connected to a certified application counselor to talk about your options. The image on the right here is a flyer that we developed along with the Mayor's Office of Immigrant Affairs and NYC Health and Hospitals to clearly lay out the various healthcare options for immigrant New Yorkers and also answer a couple other frequently asked questions. After, I assume that these slides will be shared after the presentation, and you can click the link here to access this resource in multiple languages. That's all I have today. Thank you so much.
Thanks so much, Rachel, for that brief presentation on the background, the sort of policy background of public charge. And yes, we will be sharing out these slides as well afterwards, so you'll be able to access those links. But if you have any questions for Rachel, definitely feel free to share into the chat. But otherwise, we'll just transition into the next portion of this webinar, which is really reviewing CACF and our community research findings. This was research that we had conducted with our partners. We can go to the next slide. So here at CACF, we had worked with the New York City Department of Health and Mental Hygiene to collaboratively design and conduct community-based research to document the harms of public charge on New York City's immigrant communities. So we wanted to especially thank the Protecting Immigrant Families campaign, which was able to fund this research. They are a national coalition of organizations who are doing city, state, and federal level advocacy centered on uplifting immigrant communities, really educating and supporting immigrant families specifically. So the research that we had done included analysis of existing data and research, as well as collecting new information across multiple community-based organizations and in-person navigator organizations working with immigrant communities. So our participants were really centered around community-based organization staff, like patient navigators and health outreach and education staff. Our research aimed to understand how changes in the public charge rule, including the chilling effect, impact health insurance enrollment trends, and also how it impacts service utilization in immigrant communities. We are so thankful to the CBOs that really participated in these focus groups and completed these surveys to help us gain a deeper understanding about some of the harmful impacts of tightening of public charge rules in the previous years. And then we wanted to specifically recognize the PIF partners, the African Services Committee, the Arab American Family Support Center, the Make the Road New York, and the South Asian Council for Social Services, as they were really helping us spearhead this research as well. In terms of the methods for the research, we conducted both focus groups and surveys from September 2020 to January 2021. So our research was really conducted in response to the Trump administration's expanded rule that Rachel had discussed. We were hearing a lot in the community about the chilling effect that this expanded rule had. And so we were looking to conduct research to inform how we can sort of alleviate these community concerns moving forward. And so we're really hopeful that this research can continue to help inform future responses to changes in the public charge rule in New York City. Next slide, please. So we're kind of going to go over some of the big findings of this research. The first really enlightening statistic that we saw was that nearly 80% of participants, so again, the participants being community-based organization staff, nearly 80% of them reported that they did have clients who decided not to apply for one or more non-cash government benefits, such as SNAP or housing subsidies, because the client was worried that it would disqualify them or a family member from obtaining a green card. So there was clearly a huge amount of concern. 4 and 5 participants had clients who were saying that they were not going to get these government benefits due to fears of the way that it would affect their public charge, the way that it would affect their applications. Next slide, please. We also looked more specifically into how it affected healthcare access and access to coverage. And so we saw that 58% of participants reported that some or many of their clients who are eligible for health insurance chose not to enroll. And 43% also reported that some or many of their clients who had previously had insurance chose to disenroll or to not renew their health insurance. So not only did it affect folks enrolling into new health insurance, it also caused folks to disenroll from their old health insurance as well, which really showed that these public charge changes can have a very large impact on our immigrant communities here in New York City. We also saw that over 60% of participants reported having clients who avoided or delayed care when ill, either with COVID-19 symptoms or symptoms of other illnesses. So that's a very important statistic, really just highlighting that it impacted folks getting necessary health care that they needed, going to the doctor when they were sick, because there were fears that it could really impact their immigration applications. And then of those clients, 3 in 5 avoided or delayed care, specifically because they feared that accessing free care would get them labeled as a public charge. So again, 60% were saying that they were avoiding care, and then of that 60%, 3 in 5 were doing it specifically due to fears of public charge. So there is a lot of I think it really just goes to show that there is confusion around this, and that it does really have an impact in terms of folks being able to access the free care that they should be able to access. We also saw that there was an impact on the families too. So not only did it impact individuals with themselves and disenrolling themselves, but it could also lead to them thinking that it may impact their own children. So that led to 50% of participants reporting that they had clients who chose to disenroll or refuse to renew health insurance, including Children's Medicaid, Child Health Plus, or a qualified health plan for their children. So it really goes to show that it had a really widespread impact, not only on the individual, but also other family members as well, just due to widespread fears that public charge rules may cause, or that accessing this healthcare may cause an impact on public charge. Of course, we mentioned not only did we collect sort of these quantitative statistics, but we also did a focus group where we got more qualitative data. So we just wanted to highlight 2 short quotes from these focus groups with our patient navigators. One stated, with public charge, if there is somebody with a green card or somebody undocumented, they think it is going to affect everyone. Even sometimes people with citizenship will say, oh, there is public charge, so I don't need Medicaid anymore. So I mean, that really highlights even those who had gained their citizenship and who were now citizens, they still were worried that perhaps public charge and the rules around it and the confusion around it could have an impact. Another quote we wanted to highlight were, clients are so fearful to take the essential plan or any free insurance. They say they don't want it even after I reassure them that the essential plan is not a public charge. They keep asking me to reconfirm, but they are still too scared and choose to forego it. So just goes to show essential plan as well was definitely impacted here, and access to an essential plan was impacted by public charge and continues to be. I'll now pass it over to my coworker, Medha, who will review our policy recommendations.
Yeah, so based on this research and our work at CACF, we have some recommendations both at the New York level and the national level. At the New York level, it's really about supporting 2 really important initiatives. One of them is Access Health NYC, which CACF is a co-lead in. It's a citywide initiative that funds community-based organizations to provide health education, outreach, and assistance to all New York. So really, emphasizing increasing access to healthcare coverage, making sure that there's better information that's culturally responsive, linguistically accessible, and so forth. Another one is the Community Health Workers Initiative at the UHMH. We also really recommend that people uplift that and support that. At the national level, we really advise creating and disseminating educational materials about accessing to services and public benefits in multiple languages. Also, similar information about the COVID-19 vaccine, as there was a lot of confusion around that as well. So making sure that it's accessible both by language, but also it's culturally relevant in the way that it is being provided. Also ensuring quality and accountability of language services in healthcare settings through campaigns such as Lost in Translation that CACF is leading. I'm happy to discuss that more. If anyone has questions, you can always reach out to us. And additionally, we want to uplift the work that the Protecting Immigrant Families campaign does, including their push to pass the Lift the Bar Act.
Yeah, so basically just wanted to review that all of this research and more of our findings are actually going to be released in a report that we put together. Of course, no pressure to read what's on the slide. This is sort of just a screenshot of part of the report. So it will cover the community findings that we did and also sort of connect it to today and how this is still relevant. It also reviews, for example, we found through our PIF partners, they had also done a survey this year that basically found that 31% of respondents, which were clients, Americans who were in mixed status immigrant families, 31% of them had said that they had heard nothing about the Biden administration's changes made to the public charge rule, and 47% said they had only heard a little. So that really goes to show that the chilling effect of public charge is still very relevant in our immigrant communities, even though it has been sort of the Trump administration's rules have been sort of reversed by Biden. There's not really awareness in the communities that the reversal ever occurred. So there's still a lot of fear, and there's still this sort of chilling effect. So really just goes to show the relevance of this research, and we're excited to release this report to you all via email in the coming days. Next slide, please. Finally, just wanted to wrap at least this part of the presentation and let you all know that you can always contact the CACF Health Policy team if you have any questions or just want to connect on further work. So just included the emails for myself and my coworker Meda on this slide. And so now we are going to transition into a panel discussion with our incredible community partners from the Arab American Family Support Center, Make the Road New York, and the South Asian Council for Social Services. So first I'll pass it to Salma to introduce herself.
Hi, everyone. Thank you so much for joining us. I'm Salma Mohammed, the Partnership and Capacity Building Specialist at the Arab American Family Support Center, or AAFSC. At AAFSC, what we do is strengthen marginalized communities and families across New York City by providing trauma-informed, culturally responsive, and linguistically competent wraparound services, from domestic violence case management to youth services to SNAP health insurance and ERAP enrollment. We speak 36 languages on staff, serving everyone who walks through our doors, but we do have a particular focus on Amanamza communities. So Arab, Middle Eastern, North African, Muslim, and South Asian communities that I'm sure many of us know have been historically underrepresented and underserved. Really glad to be here alongside my esteemed peers to discuss the lingering impacts of the 2019 public charge rule. And thank you to CACF for coordinating this.
Yeah, so excited to have you here, Salma, and I'll also let Rehan introduce himself.
Hello, everyone. My name is Rehan Mahmood. I'm the Director for Health Services at SACS, South Asian Council for Social Services. At SACS, we focus on 4 key areas: healthcare access, senior services, food security, and civic engagement. We speak 19 different languages, and most of our services are provided in New York City and in Long Island. Thank you.
And finally, we have Alexandra from Make the Road New York.
Hi, everyone. I'm Alexandra San Juan. I'm the Health Access Supervisor at Make the Road New York. We are a community-based organization, and we are located in Brooklyn, Queens, Westchester, and Long Island. We have different offices. We serve in different communities as well, but we more focus in the immigrant Latino community. We provide services, different type of services, including the health services like enrollment, community health advocates, and SNAP advocate services in all the offices. And we also work with other organizations, with the organizing team, to change policies and rules that are affecting the community as well.
Great. Thank you all for introducing yourselves and for being on this panel. So today I'll just be asking our panelists to answer a few questions. And for the audience, feel free to share your thoughts in the chat if you'd like. But again, we'll also save time at the end to have an open audience discussion where you can ask questions and share your thoughts on public charge. So the first question that we wanted to go through was, please describe some of your organization's work to address changes to the public charge rule.
I can jump in. At the Arab American Family Support Center, we took a multifaceted approach to addressing the changes to the public charge rule. The change came at a very precarious time for our communities, with the pandemic, we saw significant breakdowns in awareness, accessibility, and distribution of essential government relief to low-income and refugee families that already endured severe economic hardship during the pandemic and still continue to navigate its long-term effects. Particularly, for example, our anti-violence program, who's still experiencing these issues, they've been having trouble helping survivors of gender-based violence get orders of protection because of fear associated with, orders of protection potentially being a public charge. Our ERAP, SNAP, and health insurance enrollment team is still facing a lot of the issues that happened that they were facing during 2019, where folks are just completely don't really want to engage in these services and immediately are declining them because of fear for their immigration status. And a lot of folks don't know that the rule recently changed. What we did was we did 2 trainings for all of our staff about the history of the rule, the 1999 interpretation, and then the recent change in 2019 and the expanded scope. And all of our staff were trained in giving that kind of guidance in language. We were also referring clients who had these concerns immediately to our legal services team to give more direct guidance on whether or not something could be considered a public charge with the new Trump rule. But it was a huge kind of campaign where we were doing social media outreach, in-person engagement at mosques, churches, in the community. We were calling clients who were not as responsive as before. We were engaging our Know Your Rights staff in enrollment, etc. But going to pass it off to another person if you all want to add on.
Yeah, I can add. I think the best way that worked for us to address all of these concerns was approaching the clients in person. As Salma just mentioned, conducting outreach in hard-to-reach areas, partner with faith-based centers to make announcements, table on the streets, and most importantly, talk to people in their own language. That's one of the most important factors that really played a key role in making sure that people understand what public charge is and how can they access benefits. Our staff, as I said earlier, speak 19 different languages. We speak 12 South Asian languages, and our staff also speaks Mandarin, Cantonese, Spanish, Hakka, Malay, and Fijianese. So all of this, and also over the past 3-4 years, we have conducted a number of outreach events focusing on public charge in many of the underserved neighborhoods of New York City. We have seen how the news in 2019 created a ripple effect, misinformation, which is one of the major weapons to create chaos. For example, I'll just share what we saw in the field when talking to clients about public charge, about accessing benefits. People told us that they were getting calls. Obviously, these were all scam calls. That if you don't pay $2,000, you will be reported to ICE or US CIS. That you're using a public benefit and have your immigration application canceled, and also make sure that you're deported. So this was very concerning, and conversations like these usually don't happen in the open. People don't want to talk about all of these, whether you're doing an outreach event, or doing a tabling event, it has to be in one-on-one session. So we also did during the pandemic, we continued providing in-person services. We had clients, we were providing them one-on-one sessions. And another example, we had a family of 5. The parents had green card for 7 years. And they were told by their lawyer to cancel Medicaid coverage just to be on the safe side. That's what the lawyer told them, just cancel your Medicaid coverage. The kids were citizen. As I said, the parents were on green card. We had to talk them out of this, use material published by CACF, PIF, and other partners. And we were able to make sure that the disenrollment never happened. What was important, knowing the language of the client, the culture and tradition they follow, and the knowledge of the topic. All of these tools combined, all of these together helped us resolve the issue. Just imagine that this was a green card holder, not even mentioned as public charge. Another example, a client on H-1B visa. had applied for a green card. He was told by someone, maybe his lawyer or someone else, to disenroll from a marketplace plan. Why? Because it's subsidized by the government. Things like these were common sight. Seniors who I think like the most people affected by the public charge rule and by the definition of the public charge and by all the rumors that were spreading around were seniors and kids, because these two people, they tend to like kind of rely on others to make decisions on their behalf, or they don't want to make their own decisions. Like we had a senior couple who came to United States in 2019 in December, and the pandemic hit like February and March. It was pandemics till August. They didn't apply for health insurance. Why? Because out of the fear that their son who sponsored them to come here, he could be held liable, or they would be deported, because they right away when they came, within 6 months they're applying for health insurance. So we had to just like go back and forth with the family and make sure that they enroll. And now both the seniors, they are receiving services through their health insurance. They are getting access to other services. So things like these, unless and until there is an in-person approach, where like we as community-based organizations, we as partners, we like talk to the clients in person. Virtual settings works for few, but it doesn't work for the masses that we work with. Like majority of them are underserved. They don't want to share their information while being on the internet. So in-person events have really helped us a lot.
Make the Road New York created a lawsuit against the Trump era public charge rule that was Make the Road New York versus Cuccinelli. It's one of the many tactics that we use to fight against unfair policies created to further marginalize immigrant communities. We also integrated public charge messaging into all the work that we do, especially when enrollment into benefits are involved, and create opportunities to educate community members and combat misinformation. Even before the rule took effect, evidence shows the proposed rule produced a negative impact in our communities, meaning eligible immigrants, families, including those who will not be in our communities, subject to the rule, avoided enrolling in public benefit programs for fear of immigration consequences, or decided to disenroll from benefits. And this has become even more alarming during the COVID-19 pandemic, in which many immigrant families are vulnerable to acute medical and economic hardship, and families may avoid medical care and public support for fear or being deemed a public charge, despite formal clarification by the federal government that COVID-19 testing and treatment will not be considered. Given the economic and the public health crisis, it is critical to understand how the rule is affecting immigrant families. Where these families are getting their information can be attorneys, accountants, or multi-services where they just go and file taxes. They give misinformation about the rule to the people, and these sources that our people trust, they are not communicating the right messages about the rule and how it's impacting the community. We really think that the plan should be to continuously educate the people about public charges and what is in effect and what are the changes to the proposed rule before to reduce the fear and encourage them to take advantage of the benefits available to them. And also reach out to the people spreading the misinformation to stop the spread, and especially for the upcoming health insurance enrollments of people 65 and plus. We need to continue doing workshops, educational flyers to ensure that everyone knows what are the public benefit programs available to them and their families without fearing any immigration consequences. Like we just heard some of those examples. I had a family from El Salvador. She was a TPS holder, the mom. She was going through a cancer treatment, and she has 4 children, they all citizen. She was in the process to try to adjust her status from TPS to the permanent resident, and she went to her attorney, and the attorney told her that she needs to discontinue the SNAP benefits that she was getting for the children and discontinue all the medical insurance that she has for the whole family, including herself, that she was going through a cancer treatment. And she did it. When she came to our office, she already cut all the SNAP benefits. She was now working due to the cancer. She didn't have any other source to survive or to put food on the table for her family. And then she came to discontinue the medical insurance. I have to call myself the attorney's office and speak to them and educate them about what they were doing to this person and ask them, you know, you need to stop to doing this, you doing misinformation to your customers, to your clients, and making a really big damage to families and spreading misinformation, impacting really in the negative way to all the community.
Thank you all so much for sharing and also just all of the incredible work you've been doing. I mean, it just sounds like there's so much work being done sort of on a micro level in terms of individual reach out and really reaching communities individually and helping with their cases, but also on the macro level with the lawsuit, for example. So that's just really incredible work. And so the next question that we had was sort of getting more at how you see the effect still today. So sharing thoughts on how public charge continues to be a barrier in the communities you serve. Because I think we know that the Trump expansion had occurred in 2019, and then there was a reversal in 2021. But there's also this new upcoming change that's going to happen in August, likely. And so with all of this sort of switching back and forth, like, how do you all see still a chilling effect in these communities? Are folks confused? What does it look like sort of on the grounds in terms of the barriers that folks are still facing today?
Yeah, happy to jump in. I think we, like I mentioned earlier, we are still seeing a lot of lingering impacts, and it is incredibly chilling. You know, I think part of it, and I think Rehan was getting at this too, when he said that, you know, our community members don't want to talk about this in the open. Our community members, you know, the immigrant communities we serve have been over-policed, over-surveilled, like there have been numerous punitive measures historically taken against our communities. And there's a lot of like history there, a lot of fear that's been built up. Also like the rhetoric that's been used prior to the Trump era, decades prior to the Trump era, but especially during the Trump era, around needing to like pick yourself up from your bootstraps. The onus is put entirely on the community member or the person in need to figure it out. And if not, like they have to face the consequences. And that kind of exasperates a lot of the existing fear and shame. And with the different rule changes and how incredibly vague the actual policy is, even the 1999 interpretation, it is incredibly vague. And what we saw was the enforcement was that the most marginalized community members that we serve were bearing the brunt of the enforcement of the 1999 rule, even before the Trump change. But after the Trump change, and even now, like we're still seeing that fear, we're still seeing that confusion, we're still seeing that shame. It's done some real damage for our community members. And I think that, you know, part of it is also like, you know, going back to what Rehan and Alexandra were saying, part of what we've done to address that is addressing the rising mental health need in our communities and really getting root to that fear and to that shame, and explaining what the community members can access and are entitled to access. Yeah, so we'd love to pass it off to, I think, Rehan.
Thank you, Salma. I think issues like these make people scared and concerned. The fear of just getting caught in the web of immigration legalities creates a mindset that I should not apply or approach anyone to apply for Medicaid, SNAP, Child Health Plus, Essential Plan, WIC, or even go and get tested or get a COVID-19 vaccination. Though the previous administration's public charge rule we know is a history, still people think that because they're immigrants, they can be denied a visa, green card, or even citizenship, because like in the past or currently they are enrolled in a public benefit. This is like very I have been like using this quote a lot when talking to like clients. One of our clients once told me that public charge is a villain who is creating hurdles in their quest to achieve the American dream. That's something like I've never heard before. Like it was very well phrased by one of our clients. We already know that people who do not speak English, those who can barely manage to pay their rents, have to budget their groceries so that the family could at least have like 3 meals a day. They like once in a blue moon, they plan outdoor family picnic. For these underserved, hard to reach communities, the word public charge itself creates havoc. I think like just to get over this, there has to be a sustained community level effort just to build trust and reduce this ongoing fear among individuals and families. We have the access to the community. They trust us. They trust all of the CBOs, like partners who are here on the call right now. We have been providing direct services throughout the pandemic, before the pandemic. We have a food pantry which was serving during the pandemic. It was like 1,200 families who were coming to get access to the groceries that were provided at the food pantry. Now, rather than the numbers going down, the numbers are going up. Right now we have like 1,500 families who are coming every week to benefit from the services provided at the food pantry. As I said, that we have the access to the community. They trust us. When we go out in the field or when the clients come to us, we don't just provide them information or assistance in one particular area. We create a personalized approach where a client is helped in understanding public charge, and then the family is connected to all the benefits and services they're eligible for. And this relationship of trust goes on and on for a longer period of time. I think continuous communication, as initially Amy mentioned, continuous communication, outreach events through all of these initiatives, Access Health, McCAB, and through intervention from our lead agencies, CSCF and others, like we have to continuously provide the tools to all CBOs, provide the tools to the community members itself to make sure that these barriers are addressed. Thank you. Alexandra.
Yeah, I have to say that I agree with Salma and Reham, but something to take in consideration is that our communities face a lot of more barriers than language barriers, you know, and I gotta tell you, in our communities, sometimes language barriers is not only that they don't speak or understand English. Some of these families, they not even read or write in Spanish as well, or in their own language. Some of these people, they have to work 7 days a week. They do really, really hard jobs, and the conditions that they live in their houses, they can't afford to have maybe a TV on their house, you know. I know it's something hard to live sometimes. We are in United States and it's not easy to understand the economic situations and crisis that some families, they have to go through every day. But some people, they don't have sources of information. They don't read, they don't know how to read, they don't know how to read a newspaper, you know, and public charge, like Rehan clients say, is a villain that is affecting the community, right? Is something that is there. They can't understand exactly what it is because they never hear from this. They still, sometimes you explain to them, it's very hard for them to understand how this rule works, exactly what it is, and what I'm not gonna be able to get if I do anything that you know, affects this rule, or they are being affected for this rule. I think that we need to keep working, all the advocates. We need to keep working one-on-one with every single person that we can meet in the community to explain to them exactly what is the rule, to help them to forget what happened in 2019 with the Trump era, and understand what is the public charge rule now, and that they can access all the healthcare benefits, that they can access SNAP for their children, that they can bring some food to their tables if their children are citizens, even if they are undocumented, that this is not going to have any consequences of the future for them to prevent them to get a legal immigration status in this country. We need to continue educating the sources and where they had access to attorneys, accountants, or other people that they had misinformation about the public charge, is a lot to work still in the community. We have a lot of work to do. Really, I'm very concerned, and my organization is very concerned about what is going to happen next year when we start doing health insurance enrollments for the people 65 and plus. You know, these seniors, they are going to be really, really afraid to go and apply and get medical insurance because, you know, when you are the head of the household and the head of the family, you don't think about yourself. You think how this is going to affect the rest of my family in the future, right? So it's a chain. Everybody's fear is passing one to one in their family and spreading out in the communities. So we need to continue working. We need to continue doing workshops, creating flyers, creating spaces like this where all the people that we work in these amazing organizations, we are aware what is happening with this, with all the changes and the rules, and how can we continue educating the community and let them know that they have to know the rights and they need to access all the benefits that are available to them right now.
Yes, thank you all so much for sharing. And definitely, yeah, it seems like there is still a very large chilling effect. And so the work that you're doing is just so important in combating that and really reaching these far-reaching communities. So I saw that we have a couple of questions or comments in the chat, so we can sort of go through those. And yeah, we're sort of opening up the discussion a bit more now. So for Maha, she had mentioned all CBOs involved should share information on social media in different languages. No more public charge. You and your family are safe. I completely agree with that. And I was kind of curious, Rachel, if you're able to speak a little to how the upcoming rule in August will be different and sort of what sort of messaging you think would be best for CBOs to be sharing with community members.
Thanks, Amy. I think that the main messaging to be sharing here is, you know, which groups are at risk. And I think CBOs need to be sharing this. And what I'm hearing also is that legal partners also need to be made aware of these changes too, so that when folks are seeking out what they consider to be trusted advice from an attorney, they're also hearing, you know, the proper messaging. In terms of what's going to be different in the rule, we don't know quite yet until we see the final rule. In terms of what we've seen in the proposed rule, it looks a lot like what public charge guidance will be, you know, has looked like before 2019. I think a really important, you know, update, if you will, that was in the proposed rule that we hope to see in the final was a really explicit list of benefits that are not included in public charge, which I think in a lot of cases is almost more useful to have on paper and to be able to say to people tangibly, like, we know that using SNAP, we know that using Medicaid, we know that using, you know, housing assistance is not going to affect, you know, your ability to adjust your status. And so I think the main thing that we're looking for in this final rule is as much clarity as possible, because part of what has been so nefarious about the 2019 rule, and even as Salma mentioned, you know, public charge in the past, even before 2019, is that the ambiguity of it is what was so scary to people. And so as much clarity of messaging as we can provide and as much clarity as we get from DHS, the better.
Definitely. Thanks so much for that clarification, Rachel. And the next question that we have from Becca Saki from Napoth is, it sounds like a lot of additional work to address fears and enroll people in benefits. Did you all receive additional financial or other support to provide this increase of services?
Definitely no, and I'm
yeah.
sorry, I jumped out. You know,
No.
we wish that some funders, they will really aware and take seriously the fear about communities and be able to, you know, do funding to spread all this education about public charts in the communities, but unfortunately, we are not receiving extra funds for that.
Yeah, definitely. I think to my knowledge, we have not received any additional funding, and just want to echo a theme that I've been like hearing throughout this entire panel, and something that AAFSC, is always advocating for. What we see is mainstream providers are ill-equipped to handle these cases for our clients. They don't have the linguistic expertise, they don't have the cultural expertise. Many of them are not trauma informed, and it manifests in different ways. So as Alexandra mentioned, right, it's potentially not understanding that this community member doesn't have a TV and you have to engage them in a very one-to-one kind of approach, right? Or not understanding the history of shame, not only in the US, but also in that particular individual's like culture and home country, and the effective ways in which you can address that shame and fear in order to get the person to enroll in services that they are eligible for. So I think like it's a matter of, like you all said earlier in the presentation, prioritizing community-based organizations with this kind of expertise, with the community connections for funding for these kind of opportunities.
And I'll just add, so we know that the public charge rule right now, whatever was with the trauma administration, it's not effective anymore. Like it's a history. So we did the outreach at that time. We went and spoke to the clients, we provided all the services, did whatever we were supposed to do. Now, when the rule is not there, we need to do more outreach to make sure the clients who were thinking of disenrolling, who never enrolled, the clients who have like families who are still like confused whether to access the benefit or not. We need to do more outreach. So we have to expand our services. We have to get into more communities. We have to continuously be out there and help clients. So for that, definitely, we do need resources. We do need assistance from the city, from the state, and from all of the partners. So that has to be continuous. It has to be there in order to make sure that the clients have access to all the services.
Great, thank you so much both for sharing and really clarifying on that point. Since it's 2:58, I think we're probably gonna head towards wrapping. Let me just see if there's any other questions in the chat. Okay, one last one, which I saw that Alexandra had responded to, but Juan had said, thank you for this conversation. Juan Mayancela from the community organizer for Councilmember Gutierrez, a question that I have: are churches and public schools helping with the outreach? If you can you please share any one-pagers for us to distribute? So just wondering from you all on the CBO side, if you have interacted with churches and public schools who have worked on this outreach.
Yes, so we have been working with many of the faith-based centers, churches, mosques, gurdwara, temples, and have been doing outreach. So they have played a key role. And during the pandemic, I think few of the places that were open were the food pantries and the faith-based centers. So we were able to table with at these centers and then provide information. So yes, definitely we do have one-pagers. We can share that with everyone so that they can also use it towards providing information to the clients. So that had been very effective. Partnering with faith-based centers and partnering with other food pantries had really opened up the avenues to assist clients. Thank you.
Absolutely. I agree with everything Rehan said. We prioritize schools and faith-based centers, and we did utilize food distributions in our approach. We found that it's a great way to kind of get your foot in the door with community members. A lot of times, it's very hard to engage community members in a tough conversation, like public charge. But when you're offering them food, you're getting them to the table, you're getting them to look at in-language flyers. You have a staff member who speaks their language that can speak to them about these services, can pull them aside provide can refer them to another service. So yeah, definitely echoing everything that Rehan said.
Great. Yeah, thanks so much for clarifying that. And it's good to hear that those are also great avenues, it seems, to share out this information as well. So yeah, it's now 3, so we just wanted to quickly wrap, but I wanted to thank our CBO panelists for sharing and really getting into the nitty-gritty of this really important on-the-ground work. I wanted to say thank you to Rachel and the Department of Health and Mental Hygiene as well for helping co-sponsor this event, and to all of you for taking the time out of your day to attend and listen in. So after this meeting, we'll definitely make sure to share out the slides. We'll share out the recording as well. We will share out the public charge report that CACF had written on the research we had conducted with these partners, and we'll also share out, it seems like there are a lot of resources folks have mentioned to share as well, so hopefully we'll find a good way to really share those around this group and get the word out so that folks have access to more resources to share with community members. CACF will also be putting together in language resources, so lots to come in on that front, but yeah, just really excited for further partnering with you all, so definitely feel free to reach out, and thank you all again so much for coming on this call and listening in.